Hello everyone, this is Dr. Alex Vasquez with the short version of my critique of the effects of omega-3 fatty acid supplements in diabetes, recently published as the Ascend study in the New England Journal of Medicine 2018 August. If you'd like to see the longer and more detailed version of this review, please see ichnfm.org/18 for my videos from 2018. This is a randomized, placebo-controlled trial, supposedly, of 15,000 subjects. The intervention included either omega-3 fatty acids or olive oil, so this was not a placebo-controlled study. This was a comparison of relatively low-dose EPA and DHA against low-dose olive oil. So again, this is not a placebo-controlled study. This study used two active interventions. One was fish oil and the other was olive oil, both of which are notably anti-inflammatory and cardioprotective. As such, the conclusion from this study that fish oil does not benefit diabetic patients is completely invalid. Furthermore, neither of the two active treatments were independently tested for their components, and both of the treatments were provided by a drug company that has a financial interest in the failure of these treatments. The drug company Mylan specifically paid 19 of the authors, oversaw the study design and supervised its paid consultants at key meetings, provided the treatment and the active comparator, neither of which, again, were independently tested, and also makes the main competing drug in this category of cardioprotection, in this case the statin drug simvastatin. So this trial is completely invalidated. It may be randomized, but it is not placebo-controlled. They started this study in 2005, and at that time, they already knew that olive oil was cardioprotective. In fact, that had been published in the New England Journal of Medicine in 2003, 2 years prior to the start of this study. Their claim that they used olive oil as a placebo is completely absurd, because olive oil is well known to have anti-inflammatory and cardioprotective benefits, and more specifically, olive oil is known to be one of the most health-promoting and heart-protecting dietary components available. The cardioprotective benefits of olive oil have been suggested in the research since the 1950s, were more established by 1986 in a key study, and have since been validated clinically and mechanistically. In my more than 20 years of looking at biomedical research, I have never seen a drug company so well entrenched within a study design, including supervising key meetings and paying 19 of the authors. In the text of the article, the authors describe themselves as independent investigators, despite the fact that 19 of them received payment from various drug companies intimately involved with the study. Furthermore, again, the drug company provided both the active treatment and its comparator. Authors were paid by the drug companies, but these conflicts of interest were not published in the article. Products were not independently tested. The omega-3 index was tested in 152 subjects. This is less than 1% of the study population, and I found that to be rather weak. I also noted that their baseline omega-3 index was abnormally high, and their response to the omega-3 supplementation was also abnormally high, considering that they used only 1/2 of the typically effective dose. Now let's take a quick look at some examples from the disclosure forms. Again, these were not printed in the article, but they are, of course, very highly relevant, considering that 19 of the authors were paid by drug companies, including Bayer, on 4 different occasions, also Solvay Pharmaceuticals, Abbott Pharmaceuticals, and Mylan Pharmaceuticals. You'll see that this pattern was recurrent among 19 of the authors of this study. And perhaps even more impressive is the fact that this was not published in the article. One has to go to the New England Journal of Medicine website to find this documentation. What can be done about this is that we all have to become better critical thinkers and careful readers so that we can spot these gross errors in biomedical research publications. What clinicians should do is to continue using fish oil supplements, generally at a dose of 1900 milligrams per day, if the goal is to optimize the omega-3 index to approximately 10%. Thank you very much for looking at this brief presentation. If you'd like to see the full version, please go to ichnfm.org/18. Those are the videos I've produced in 2018, and what you'll see there is the complete video as well as a PDF transcript.